The Minnesota Department of Health announcing it will approve edibles for patients in the state's medical cannabis program. No new conditions for being prescribed marijuana were added this year, despite many petitioning. KMT News 3's Jeremy Wall is live to explain. Jeremy?
Katie, the edibles that were approved by the state will be in the form of gummies and chews. They will be for patients who cannot tolerate current available forms of medical cannabis. According to Minnesota Commissioner of Health Jan Malcolm, the edibles will not be for people dealing with anxiety. People here in Rochester have mixed feelings about that ruling.
I believe medical marijuana might be a good choice, but it all depends. Should be up to the person that has the condition instead of the state of Minnesota, honestly.
Luke Nelson thinks the state has too much say when it comes to medical marijuana. I also spoke with Shafiq Sheikh, who believes more research should have been done before the state health department made the decision.
Are there any research studies that show that marijuana reduces anxiety? If so, then it would make sense.
Since 2016, petitioners have requested anxiety disorder or panic disorder should qualify for medical cannabis. Each year was denied due to lack of clinical evidence and the desire to avoid any unintended consequences. Frank Weber believes the edibles should be for people dealing with anxiety.
I don't really think that's the greatest, I think a step backwards in the way that we view medical marijuana. I think it's overall just not good.
This year, the MDH Office of Medical Cannabis conducted an in-depth review of anxiety disorder as a qualifying medical condition. It was not approved due to a lack of scientific evidence to support effectiveness.
The edibles will be available to medical cannabis program patients in August. Live in Rochester, Jeremy Wall, KIMT News 3.
Thanks, Jeremy. Next March, dried smokable cannabis will be an option for some patients. That measure was passed by the Minnesota legislature earlier this year.